now. That's I'm telling you. We are still in the beginning of the race. I don't want any store to be behind because there'll be consequences for that store. I'm telling you from now. Any team who is behind, there will be consequences that I don't like to do, but I'm forced to do. I want to make it clear for everyone. So please, everyone make sure that you are good on expand. That's what we're asking for. Only that's what you're asking for. So how do you want to persuade those patients? How you can be persuasive and how you can be smart in convincing those patients. Yes, till October, you don't know. We don't know if we will have it in stock by October, by the way. That's how we can answer, and that's true. We need to work together to get, we can still be in the game and to accelerate. Last week we got 91%, 89% on target. We missed 11% of D5 on the flu because some of the teams are not playing. So I need to make sure that all of our teams are aware of this. I need everyone to play.
Well, we're having a lot of trouble getting people want the shot because of the CDC recommending it's not that they said not to get it yet.
Okay. And I'm having that same issue. I'm having the same issue. I actually have a lot of providers and healthcare providers that come to my pharmacy, and I've had doctors, like specifically one, kind of go at it with one of my technicians when he just let him know that we had the vaccine to see if he was interested, because he's like, the vaccine only lasts 6 months, and he's pushing this on people and my customers, and they're basically telling them not to get the vaccine yet. So they're starting to come in and get it now, but we have a lot of pushback because we're doing it so early. So I try to tell them that, with COVID, we just want to make sure that they're protected, to make sure that they're covered for the flu, but at the same time, when your doctor, it's not going to last a year. So at the end of the season, it's going to wear off, and it's mainly going to affect these older people. And some insurance companies, or if not all the insurance companies, may not pay for them to get the vaccine twice. So when they have their doctor saying don't do it yet, it's kind of like a conflict. And that's the main issue.
I mean, we're kind of seeing the same thing because, we've got patients, everybody's kind of looking at the CDC website a little more, and right on the CDC page it says, people who get shots in August, there's concern of the vaccine waning. Not only that, we got word literally across the street from the Air Force base, and they're telling people not to get it till October. And, kind of same thing with the doctors as well, just everybody's getting conflicting information.
That's good stuff.
That's why people aren't wanting to get it.
That's good stuff. So that's why, and you are right. You know why? Because we are in competition with those doctors. You are right. The study shows that 30% of increase in 30% of the patients that they want to do it in the community pharmacy versus doctors, and those doctors are worried, and that's what they are using, or what they are using. I want you to use your expertise as a pharmacist. You are doctors too. That's the competition. You are right. They are trying to let them know because they want to make sure that they will take it later on, either in the clinic or not. But the question is, if a patient...
I think a lot of our trouble is Louisiana's still on quarantine, whereas Texas and other places aren't, and we aren't having as many people come in. They're still in quarantine.
I don't want to listen to what they are saying because, again, this is all marketing thing that they are trying to do. Those doctors are trying to take those customers from you. They know this. They know that they are not ready yet. You know why? Because no one has the flu. No one has the flu in stock. No clinic, no doctor has the flu in stock right now. Make sure that we will receive a shipment early in August, and no one has it. No one has it. Only few competitors that they have it now in stock, and some branders and some stuff. But again, those doctors, they are not on the distribution list for Metaxan and others, so they will give them second. After they give the retail pharmacies, they will have it in stock. That's why they are pushing to them. Yes, do it in October because they know that they will lose those patients. So it's all the smart thing that they are trying to do to convince. Your job as pharmacist, and you are the most, as I told you before, you are the second trusted healthcare professional after nurses. Those patients that you are talking about, they are being convinced more, they trust you more than those doctors. That's for a reason. Again, that's the reason why you are second after nurses, not doctors. Why? Because they don't believe in it. The doctors, they want to make their benefit. They don't care if this patient gets a flu in September and COVID-19 and in the hospital. They don't care.
Personally, I do think 10 is a lot for our store. I really do. So I've been here this morning. I have not had a lot of patients come in. I've done 2 as of right now. And personally, I do ask. I ask and I ask and I ask. So It's not even me asking my patients to ask to. I'm personally going out of my way and asking my patients because I want to make sure that they do get it. And I truly believe in the flu shot. So it's not, I'm not trying to sell something that I don't personally believe in. We're currently at C today, and I've been asking, but I've hardly had any customers come in as of yet in the store. So I know my team, as a team, we could do better. Like, I know that for a fact, because I know there's days where we have zeros, and I've talked to my team about it, and I told them that this is not acceptable, and we need to work on it. So I know that we could do better, but at the same time, I'm trying to be realistic for our store. Like,
how we can convince those patients, how we can persuade those patients to get those shots. And yes, the eyes will be on you. Mike will send me those stores every week, and they'll tell me what you're doing on those. And they wanted to put you on action plan. And the action plan will go with consequences about, I don't want this to happen.
Okay, now that you heard it, there's a couple things that I really didn't like. One, I don't like when they say, when the district leader's like, oh, we got to be in the race, we got to be in the game. This is not a game. Obviously, if you can have the opportunity to get the flu shot first, then yes. But if the customer is uncomfortable or doesn't want the flu shot in early August, then, that's it. They keep saying you got to persuade the customer. You got to persuade the customer. As pharmacists, as healthcare providers, we don't persuade. We make recommendations. We can recommend the flu shot, but it's not our job to persuade them to get the flu shot at that moment. You could hear the last pharmacist that spoke, you can hear in his voice, he's trying. In his voice, you could tell, it kind of seems like he's just kind of nervous and kind of overwhelmed because he's trying to get shots, but they can't get shots. I don't feel like it's right that pharmacy managers can be reprimanded because they didn't get a certain amount of flu shots. Like, we didn't go to school to learn how to persuade people. We went to school to learn how to make recommendations to give the best outcome for the patients. Like, vaccine persuasion 101 was not a course when I went to pharmacy school, okay? And the fact that these retail companies can try to reprimand and write up pharmacy managers if they don't get 10 shots per day. Are you telling me you're going to possibly write somebody up and have them lose their job and ruin their ability to provide not only for themselves but for their family because they can't get 10 shots per day? Like, I'll give you a perfect example. A lot of times district managers or leaders will say, well, this store is doing this, then you should be able to do it too. That's not true, because my flu shot goal was 1,800 shots, right? And the clientele that I had, they just loved flu shots. I never really called for clinics. If a company called me and said, hey, can you do a clinic, I would do it, but I wouldn't reach out to people because I knew that I could reach my 1,800 flu shot goal without even really doing it in clinics. That doesn't mean that I'm trying harder than another store. That's just the clientele that I have. So you can't punish a pharmacy manager who's trying because their clientele, maybe they don't believe in flu shots, or they want to wait till later in the year, or they'd rather get their flu shot at the doctor. Yes, you could reprimand them if they're not trying, if they're not asking every customer, if they're not reaching out for flu clinics. Yes, I get that. I believe that, the companies, have the right to do that and should do that. At the end of the day, they are a business, so I'm okay with them saying, hey, you have to ask every customer. I'm okay with them saying, like, hey, you have to reach out for flu clinics. But no pharmacist should have to risk being fired because they don't get 10 flu shots per day. Like I said, our job is to recommend, not to persuade, okay? We're not car salesmen, we're healthcare professionals. And I don't like the fact when the pharmacists are saying, like, well, the CDC says wait to September, or their doctors are saying wait to September, and the district leader's like, well, that's just kind of a marketing tool, or that's just what the doctors are telling them because they don't get a shipment till September or October. For one, you're pinning he's trying to pin pharmacists against doctors. We're not against each other. We're working with each other to get the best healthcare outcome for the patients. I believe, if I remember correctly, he said that doctors don't care if their patients end up in the hospital with the the flu, you know, because they could do that if they don't get the shot now and wait till September or October. They don't care about that. They just care about getting the sale. You know, I asked like 7 of my friends that are doctors, and they said they really don't care that much about the flu shot. Like, it's not like such a huge part of their business that they have to have the flu shot. They just care if their patients get it. So for him to say something like that, I don't think doctors or the AMA would appreciate if they knew that big retail chains were saying that the doctors are only telling patients to wait till later in the year because they just want the sale, and they don't care if they end up in the hospital if they get the flu in early September. You know, I feel like we're never going to move the profession forward, especially if these big retail companies have this mindset that doctors are our competition, or try to pin pharmacists against doctors. No, we're supposed to be working together to help patients get to optimize their health. You know, with this type of mindset, we'll never get things like provider status. You know, we're supposed to be working with doctors. I don't see the doctor as my competition for a flu shot. No, I work with the doctors. Hey guys, that was my opinion. Just kind of wanted to see what were your thoughts. You know, maybe if you guys can mention something that maybe I missed that I didn't bring up. If you agree or disagree, put it in the comments. You know, I have several news reporters that reach out to me. You know, they want to do stories about pharmacy, and some of them are working on stories about pharmacy, but with the pandemic and all the racial issues going in the country, those stories are kind of their primary focus, and the stories they have about retail pharmacy are pushed back on the back burner. But you know, hopefully when the pandemic goes away, and hopefully as a country we can come together and start loving each other again. You know, they're going to be able to do other articles about pharmacy, and they look at these videos, and you know, they message me. So please comment, please share, please like, and please subscribe. Have a good day.